Weeks of talks between the doctors' union, the BMA and the government trying to avert a fresh round of strikes have failed to find a breakthrough. So once again, patients in England are facing 5 days of disruption and uncertainty. Hospital managers have been told to aim to keep 95% of planned care running as normal. Good news for those like Alex, who's already waited 18 months for a consultant follow-up after a heart attack, but he feels his sympathy for the doctors fading.
To me, it seems a little bit pointless. They will obviously argue differently, but they've already had a substantial pay rise, and to then do another pay rise, I think maybe the public probably aren't as supportive this time as they were last time, me included.
This strike action, the 13th since March 2023, centres largely, but not exclusively, on pay. The government and the BMA have already agreed a pay rise worth 22% spread over 2 years. This year they've been awarded an average pay increase worth 5.4%. But the BMA says that still leaves their members 20% worse off compared with 2008. The union's strike mandate is focused on pay, but doctors say many are also struggling to find speciality training places.
We do need to see credible movement on the jobs front to get doctors into jobs in the NHS, and we also need to see credible movement on pay to value the doctors that we currently have in the NHS. Meanwhile, patients are being trapped in corridors and, people are still struggling to find GP appointments. So it's a pretty absurd situation and we feel like we have no choice.
It's really nice to meet you.
The Health Secretary, Wes Streeting, has offered to boost the number of training places as well as covering the cost of exam fees for doctors. But he says there can be no further movement on pay.
The worst thing is that because they're choosing to take this course, there will be disruption for patients. This is going to put pressure on other NHS staff, and there's enough to cope with winter coming too.
NHS England says patients should still come forward for care as usual, but the worry is the broader impact this long-running dispute will have on an already stressed NHS. Dominic